conducting the comprehensive assessment for Tina Jones for Aspen University. Tina Jones is visiting the clinic today for a comprehensive health assessment and a pre-employment screening. And the next video you see will be of this assessment. Thank you. So we're going to begin by inspecting Tina's head. We'll inspect the scalp. Looks good. Next, we're going to inspect the eyes, starting with the right eye. Looks good. Pupil looks good. The whites of the eyes look good. No redness, no misshapen foreign bodies. Excellent. Next to the mouth and throat. I'm going to go ahead and depress the tongue. And while we're inspecting, we're looking for cobblestoning, any ulcerations, checking her dentition as well. Also looking at the tonsils, making sure they're not enlarged or inflamed. Looks good. Next, we're going to move to the eyelids. Checking the upper eyelids. Looks good. Onto the lower eyelids. Pink and moist. Excellent. Looking outwardly at the ears. While we're looking at the ears, we can also notice some of the acne on Ms. Jones's face. Keeping in mind that we're also assessing skin and other body systems while we're performing this assessment. I'll look at the scalp now. Feeling for any bumps. Everything looks good. No masses palpable. Moving on to the lymph nodes. We're going to start with the cervical lymph nodes. No masses, no tenderness. Next, we're going to go to the supraclavicular nodes. In the neck, no nodes, no palpable masses, no tenderness. We go to the thyroid next. We're going to have her swallow a little bit of water. We check for a goiter or nodules. There are none. Next, we're going to go and palpate her TMJ. I'm going to ask her to open and close her mouth. No clicking, full range of motion. Next, we're going to palpate the sinuses, searching for tenderness, starting with the upper sinus. No pain. Lower sinuses, no pain. Moving along, we're going to palpate the axillary lymph nodes. And there are no palpable nodes. I'm going to use the pen light now, assess her pupillary reflex. Turn it on. You see the pupil get smaller. Turn it off, the pupil dilates back. Moving over to the left eye. Excellent. And this is a normal finding. Next, we're going to go to the ophthalmoscope. We're going to inspect the right eye first. And I don't see any foreign bodies. We're going to inspect the fundus. And everything looks good there. Now go to the left eye. No foreign bodies. Pupil looks good. Iris looks good. Moving into the fundus. No foreign bodies. Fundus looks good. Now use the otoscope to inspect her ears and her nose. Look at the right nostril. It is patent, no drainage. Same thing for the left nostril. Patent, no drainage. Looking at the left ear, we see it appears pearly gray with the cone of light at 7 o'clock. There's no excess cerumen. We'll now go to the right ear. And it looks just like the left ear. Cone of light is at 5 o'clock. Pearly gray and no cerumen and no redness. Assess her eye movements now. We're going to ask her to follow our finger with just her eyes.
Okay.
And we're going to move in a pattern. Looks good. No lazy eye. No nystagmus. And that looks great. Next, we're going to assess her peripheral vision.
Okay, I will. Now.
Excellent, and that's a normal finding. We're going to look at her visual acuity now. I'm going to ask her to cover her left eye while she reads this line.
SP. SP.
And moving down.
TOZ. TOZ. LPED. LPED. PECFD. PECFD.
Good job. Let's try this again.
EDFCZP.
Good. And try it again.
EDFCZP.
Excellent. Let's try one more.
FELOPZD.
Good. Cover the left eye.
FELOPZD.
Very nice. Moving along.
DEFPOTEC.
All right. Cover the right eye. Read again.
DEFPOTEC.
Excellent. Let's try one more.
I can't read that line. It's too little.
All right.
I can't read that line. It's too little.
Okay, Tina has 20/20 vision. Excellent. In both eyes. We're now going to perform the whisper test. First in the right ear, so we're going to have her go ahead and plug up her left ear.
F.
F.
8.
8.
W.
W.
And same thing for the left ear while plugging the right ear.
4.
4.
R.
R.
9.
9.
Good job. And all the while we're assessing the skin as well. We can notice some excess facial hair, and we also see some acne, and we'll be addressing that later. We've finished the head, eye, ears, nose, and throat portion. Moving on to the GI portion. Going to inspect her abdomen. And we see the abdomen to the front. See excess hair from the pubis to the umbilicus, as well as some striae. And there we go. We're next going to palpate the abdomen, starting counterclockwise, starting in the right upper quadrant. Moving along. Good job. We're now going to palpate deep, starting in the right upper quadrant, moving clockwise once more. And on soft palpitation, she did not have any masses, no complaints of pain. Good work. And moving along, right lower quadrant, no masses in any quadrant, felt with deep palpation. We're now going to palpate the organs, starting with the liver. We see that's palpable 1 centimeter below the right costal margin. This is a normal finding. I'm going to attempt to palpate the spleen. We are unable to do so. This is an expected finding. We'll now attempt to palpate the kidneys, both right and left. And the kidneys are not palpable. This means the kidneys are not swollen. This is a good finding. We're now going to percuss the entire span of the liver. Here we hear that dullness. Excellent. Liver spans rating at 7 centimeters on percussion. Excellent. We're now going to percuss the entire abdomen, clockwise, starting in the right lower quadrant. Tympanic. No dullness over the spleen. All other quadrants are tympanic, and this is a normal finding. This means there's likely no blockage. I'm now going to auscultate for bowel sounds. Normoreactive bowel sounds. This is a normal finding. We're now going to assess for CVA tenderness. And this will let us know if there's any issues with the kidneys, any swelling, and we have no CVA tenderness. This is an expected finding. We're going to move on to the cardiovascular portion. We are going to start looking at the legs for edema. And looking at the bilateral legs, we see none. We're going to palpate those peripheral pulses in the lower. Starting with the right femoral pulse. It is palpable, +2. Checking the dorsalis pedis pulse. All the while, we're also looking at skin to see if there's any abnormalities. Good. And the posterior tibial pulse. Moving to the left leg. And finishing up on the left femoral pulse. All pulse is palpable at a +2. While we have her laying down, we're going to assess the capillary refill of her toes, starting with the right pinky. In here, we're looking for a return of blood flow within 3 seconds. And this will show us that her feet are being adequately perfused. Looking good so far. Good on that foot. We're going to now move to the right great toe, the left great toe, I'm sorry. Good. All right. And the last toe. Excellent. Capillary refill looks excellent on both feet. We're now going to go ahead and palpate the peripheral upper pulses, both hands. Right brachial looks good. Right radial. Going over to the left radial. Up to the left brachial. And all readings are at a +2. We'll look at the capillary refill now in the fingers. Once again, same as the toes, assessing for capillary refill. We want this to be no greater than 3 seconds. This is testing for adequate perfusion to her extremities. Looking good. And this is normal. Looks good. All right. All digits on both hands are adequately perfused. We are now going to inspect her anterior chest. And we see her lungs seem to be expanding normal, no use of accessory muscles. Everything looks great. We're now going to palpate her carotid arteries. Left carotid is 2+ with no thrill. The right carotid is also a 2+ with no thrill. We're going to now auscultate those carotids. No bruit on the left. Moving to the right. And we have no bruit there either. Now we're going to auscultate cardiac points. Moving over all 5 points. All 5 points sound great. Audible S1 and S2. No arrhythmia detected. Nice strong heartbeat. We're now going to auscultate the abdominal arteries. We are going to start at the right femoral artery and work our way clockwise. No bruit. And no bruit detected in any of the abdominal arteries. We're going to finish off with palpating Tina's PMI. And her PMI is not displaced. There's no heaves or lifts. This is an expected finding. We are now going to move on to her respiratory assessment. We are going to go ahead and inspect her posterior chest, her back. Also looking at skin. And we see Tina's back. You can see as she's breathing, seems to be normal. Now I'm going to inspect her anterior chest. Also looking at skin. Watching her breathing. No use of any accessory muscles. Good. We're now going to palpate for tactile fremitus posteriorly.
99, 99, 99.
And this is equal bilaterally in all aspects posteriorly. We're now going to perform the same test on her anterior chest.
99, 99.
And everything is equal bilaterally in the aspects of her anterior chest wall. Now I'm going to palpate for symmetry, chest expansion on the posterior lung fields. Everything is symmetric. We're now going to percuss the posterior chest while we're back here, starting in a clockwise motion with the upper left. And we don't want to hear any dullness or tympany. And as we hear, these are all resonant in all fields. And while we have her posterior facing us, we're going to go ahead and auscultate in the same fashion, clockwise. Keeping in mind that we're listening for any wheezes, bronchi, crackles, coarseness. Excellent. All lung fields are clear posteriorly, no wheezing, no bronchi, no crackles. We are now going to go to the anterior chest. We are going to percuss in a clockwise fashion, starting in the right lower chest. And we do want to hear resonance. We don't want tympany or dullness. Excellent. I'm going to finish off with auscultating the anterior chest, moving in the same fashion, clockwise. Very good. No adventitious lung sounds. Everything sounds clear. Lung sounds are active in all fields. We're going to finish off with a spirometry test. I'm going to ask her to blow into the spirometer. FVC of 1.78 and FEV of 1.549, and based on her age, these are normal findings, age and weight. Moving right along, we're going to go to her neurological assessment. We're going to ask her to run her right foot down her shin.
Sure.
We'll now do the same for her left foot.
Okay.
Looks good. We're now going to look at her deep tendon reflexes on her lower body. And deep tendon reflexes of the lower body look good. We are going to test the position sense of her toes.
Okay, I will.
So we're going to assess her left foot first.
Down.
Now the right foot.
I think that was up.
It's good. Now we're going to go ahead and test her finger to nose.
I can do that.
Very good. We are going to assess her hand movements. We're going to ask her to place her hands on her knees.
Okay, like this?
Very good. Now I'm going to assess her orientation. My apologies. Tina, what is your name and date of birth?
My name is Tina Jones, and I was born on February 17th.
What building are you in now?
I'm at the doctor's office. It's Shadow Health General Clinic.
What is the date and year?
Today's date is...
Thank you, Tina. As we can see, Tina is oriented to time, place, and person. We're now going to start assessing her fingers. Close your eyes and tell me if your finger moves up or down.
Okay, I will.
I'm going to start with the left hand.
Up.
Very good. Now the right hand.
Down.
Excellent. We're going to assess your sense of touch. Close your eyes and tell me if the touch is sharp, dull, or soft.
Okay. Dull. 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 Dull.
Very good. going to test again.
Soft. 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 Soft.
Excellent.
Okay.
And finally, sharp.
Sharp. Sharp. Sharp. Sharp.
Very good. Now we're going to assess this again on the upper extremities. Close your eyes and tell me if the touch is sharp, dull, or soft.
Okay. Dull. 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 Dull.
Very good. Once more.
Soft. 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 Soft.
Very good. Last test.
Sharp. 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 Sharp.
Very nice. Good work, Tina. All right, Tina. We are now going to test your upper deep tendon reflexes. Working clockwise, work our way up the arm and over to the other arm. Deep tendon reflexes on the right are all 2+. This is a normal finding, all intact. Moving to the left arm. Good. Good. Reflexes are all intact. +2 on the left arm as well. This is a normal finding. We are going to use the monofilament now on her feet. Close your eyes and tell me when you feel the touch.
Okay, I will.
We're going to choose parts of her feet to touch and see when she feels this. You can see the old previous wound.
Yes.
She feels that there. All right, she did not feel that.
Yes.
Okay. So that's a significant finding. She does have some decreased sensation in this right foot. So we are concerned about that. We're going to move over to the left. Okay. All right.
Yes.
Okay, significant finding for the left foot as well. She does have significantly decreased sensation. We are concerned about this because Tina is a diabetic, so we will probably refer her to a podiatrist to follow up with this. That is a concern. We are finally going to test out her graphesthesia and her stereognosis. Tina, close your eyes and tell me what I trace on your palm.
Okay. That's an A.
Good work. Look at your right hand now.
A figure 8.
Very good. Good work. Okay, Tina, now we're going to test your stereognosis. I'm going to put a item in your hand. So close your eyes and tell me what I put in your hand.
Okay, sure.
I'm going to start with your left hand.
That feels like a key.
Okay.
This is some wire thing. Paperclip? Some kind of coin.
Good job. I'm going to move over to your right hand now.
That feels like a key. The paperclip again.
Good work.
Some kind of coin.
Good job, Tina. You identified all those items. Well, this concludes your neurological assessment. We're going to go ahead and move on now to your musculoskeletal assessment. And look at everything. Have you step off there. And the whole time we're looking at her skin, everything. We do see this acne. She does have some facial hair. This is normal finding for somebody who suffers from PCOS. We do see some striae, some keratosis, discoloration there. This is indicative of diabetes, insulin resistance. And we see excess hair growth here and the acne. And we do see that with the PCOS. And sometimes these symptoms can get resolved with the addition of the birth control pill that we're taking. So we might see some improvement with the acne. Very good. Okay, Tina. Look at your abdomen. You see some striae there. We're going to inspect the arms. Raise that arm up. We'll look at that shoulder, elbow, no discoloration, no abnormalities. Check that shoulder posteriorly. Excellent. The right shoulder, the dislocation. Very good. I want to inspect those hands. We've been looking at the hands all day. Hands look good. I'll go ahead and look at the lower body and inspect the hips. Those look good. Right leg looks good. Right hip. Good. Right knee and right ankle. Now we'll look posteriorly on the right leg, on that left leg. Posterior part of the hips. Excellent. Left hip, left knee, and your left ankle. All look good, and no concerns. And we're going to look at the ankle.
Those look good. And let's finish out with the left and right knee. Excellent. All right, we're going to look at that knee strength right now. When I push lightly on your shins, I want you to straighten your legs out all the way. Good. We're going to conduct a series of tests like this to assess your musculoskeletal strength. We're going to go ahead and assess your neck strength. Ask you to turn your head, and I'm going to resist the movement with my hand. Good. Tilt your head to the right. I'll resist your movement. Good. I'll tilt your head to the left, and I will resist your movement. Good. Look at that bicep strength. We're going to pull on those forearms. Curl your arms up. Nice. Now we're going to push those forearms. Keep your palms up. Straighten your arms out as I push back. Good. So far, everything has been a 5 out of 5. Nice and strong. I'll look at that shoulder strength while we're up here. I'm going to push on your shoulders. Shrug your shoulders up against my resistance. Just like that. Perfect. We'll look at your range of motion in your neck. Tilt your head back and look towards the ceiling. Good job, Tina. Now I want you to touch your chin to your chest. Very good. Now I want you to touch your shoulders with your ears side to side. Just like that. Good. Excellent. Now we're going to go ahead and have you turn your head from side to side. Very nice. Good range of motion in the neck, no concerns. All right, now we're going to go ahead and assess your hand strength and your wrists. Keep your forearms straight and tilt your wrists up to the ceiling. Very nice. Keep your forearms straight and tilt your wrists down to the floor. Very good. 5 out of 5. Now I want you to grab my fingers and squeeze. Very good. I'm going to test the range of motion in your wrist. We're going to ask you to add and abduct your wrist. I want you to turn your wrist to bring your fingers together and then apart. Very nice. Now I want you to put your hands out, palms down, and point your fingers towards the ceiling. Good. And finally, I want you to put your palms out, palms down, and point your fingers towards the floor. Very nice. Look at the range of motion in your elbows. Bend, then straighten your elbows. There we go. And now I want you to turn your palms up to the ceiling, then down to the floor with your arms extended. Very good. We're going to look at your shoulders. I want you to cross each arm in front of your body. Very nice. Very nice. I want you to put your hands behind your back. And I don't see any pain, discomfort. Everything has exhibited full range of motion so far. Now I want you to raise your arms in front of you and overhead. Very good job, Tina. Tina, so far your strength is 5 of 5 and your range of motion is completely intact. You just have a couple more tests to do. All right. We'll look at your spine. So we're going to go ahead and stand up and bend back as far as you can. Very nice. Full range. Now I want you to bend over and touch your toes. Just like that. Thank you. Now I want you to go ahead and bend from your waist side to side. Very nice. And finally, I want you to rotate. I want you to twist from side to side from your waist. Just like that. Yep. Right and left. Very good. Thank you, Tina. All right, Tina, go ahead and lay back down. We're going to go ahead and test your ankle strength. Okay. I want you to point your toes like you're pushing a gas pedal. Resist against my hands. Very good. Very good. Nice and strong there. I'm going to test your range of motion now in your ankles. Rotate your left foot away from you so you can see the bottom edge of your foot. And then I want you to rotate it towards you so you can see the bottom of your foot. Repeat, and then repeat this with your right foot as well. Very good. Tina, now we're going to test your extension and your flexion. I want you to point your toes towards the ceiling and then towards the floor. So that's going to be your dorsiflexion, and pointing down, that's your plantar flexion. Everything looks great. Full range of motion. I'm going to go ahead and look at the range of motion in your knees. Go ahead and straighten your legs. Good. Now go ahead and raise each knee up to your chest. Excellent. Good work. Good work. Fantastic. Now we're going to look at that hip strength. I'm going to resist your movement. Push your knees up towards the ceiling. There we go. All right. Finally, we're going to look at the range of motion in your hips. So we're going to go ahead and have you lay down. And we're going to move each leg out to the side. Great. Tina, you're doing great. We're going to check the adductor muscles. We're going to move each leg underneath the opposite one. We're going to scissor them together. There you go. Fantastic. Now I want you to lay on your stomach and lift your heels towards the ceiling. Very good. Full range of motion there. And finally, we're going to finish with laying on your back. And we're going to lift our toes up to the ceiling, keeping your legs straight. Good. Full range of motion there. And full range of motion there as well. Tina, that concludes your musculoskeletal exam. We're going to finish out here with your skin, hair, and nails. You've done really well so far. All right, Tina. Going to look at your hair and scalp. Hair looks good. The scalp looks good. And we're going to look at your toenails really quick. Looked at those toes once already. The toes look good. Good coloration. Good nail beds. With those fingernails. Nice and clean. Good color. Good nail beds. Everything looks great there. And finally, we're just going to look at the overall skin. Skin of the face. We do have a little bit of acne and some hair growth on your upper lip. All right, I'm going to turn to the side. A little bit of excess hair growth here on the sideburn. We have the striae on the neck, the discoloration, the keratinosis. And that's a common finding in people who are insulin resistant. And we see some acne here as well. And like I mentioned earlier, that could clear up being on the birth control pill. We'll look at the abdomen really quick. We have the striae, a little discoloration, a little excess hair from the pubis to the umbilicus. Yeah. See a little bit of striae here on the back as well. All right. And we'll finish out on those feet. And we've seen the feet earlier today doing the monofilament test. We can also see your previous injury here to your right foot when you scraped it outside. So that's healed up very nicely. Other than that, the feet look great. Yep. Left foot, right foot. Excellent. Dina, that concludes your head-to-toe assessment for your pre-employment physical. You passed with flying colors. We only have a little bit of concern for the lack of sensation in your bilateral feet. We're going to refer you to follow up with a podiatrist. And other than that, everything looks fantastic, and I want to thank you for joining us today.